Now, lots of questions about the cost of dental implants. So what affects the cost?
Sure. There's about 9 things that affect the cost.
Okay.
One of the things I'd like to start with is the number of doctors that are involved. Okay, the more doctors you have involved, the more it's going to cost.
Okay.
The type of implants that we use. There's many different types of implants. There's specialized implants that we use if you don't have bone. There's mini implants, which we do not use.
The mini dental implants?
Yes, we don't use those.
Okay.
But there are a number of different kinds of implants that we can use, so that would also affect the cost.
Are you using what you're considering like the gold standard for dental implants?
Sure. So we use titanium, pure titanium implants. That's right. So that's the gold standard. That's what 95% of implants that are out there are titanium implants.
Okay.
Labs. We partner with labs to try to bring some of the costs down, but that's a big part of it is the lab bill. So they design the teeth. They usually send us the file. We can print it. They make the final teeth.
When you say print it, you're actually printing teeth on site in your office.
Right in our office.
So that could cut some cost and time.
That cuts costs. Absolutely.
Okay.
Absolutely. It cuts time too because we can get it right then and there. And then the final teeth are made out of a material called zirconia, which is quite costly to actually mill. It takes several hours of man-hour time to actually mill those teeth.
So the final teeth, you prefer zirconia.
Correct.
Is that also considered like the gold standard in implant dentistry?
It is.
What could they be made out of? Like what are some of the materials?
So they could be made out of...
You can cut corners, I guess.
Acrylic. If they were made out of acrylic,
like
that would
denture teeth?
Like denture teeth, yeah, but they're not going to last as long.
Okay.
So what your final teeth are made of affects the cost. So our teeth, the final teeth that we deliver are made out of something called zirconia. Other practices, their final teeth may be something more along the lines of acrylic. So that's
like denture teeth?
Like denture teeth. They're not going to last as long. So you're going to want to know that kind of information up front.
Now, I did some Googling. And we talked about this, that what you use as temporary teeth before they get to the zirconia teeth, they're now using as the permanent teeth that would say or appear to be less expensive like online when you Google things.
Correct.
Can you speak to that a little bit?
Yeah, I mean, they're essentially using that to get you into the office, and then there'll be a bill later on for the final zirconia. So they're not telling you that part.
Okay, so you have kind of like an all-inclusive kind of a price.
Correct.
And you're giving everybody those zirconia.
Our standard is to deliver zirconia.
Okay, good. Okay, good.
Yeah.
What else affects the cost?
So is it a snap-in denture, or are those teeth fixed in your mouth, fixed in place, meaning they don't come out?
Okay.
So that's going to be different. So we don't do a lot of the snap-in dentures, but we do them in certain instances. But that's going to definitely affect the cost. Those are less costly than the fixed teeth.
So when you Google things online, it looks like you're getting teeth that don't come out, but they're really just snap-in dentures.
Correct.
Is that right?
They're regular dentures that are more secure, but they're not fixed in place teeth.
What about insurance?
Yeah.
Because lots of questions about insurance. Does insurance cover this or not?
So Medicare, Medicaid, and insurance typically won't cover any part of this. The only thing that they may have some coverage on is the extractions.
Okay.
So, which is a very small part of this whole thing. However, the good news is that we work with a multiple number of financing companies that help us get this paid for the patient.
So people are financing it. Like what percentage of people that are getting a full arch of teeth?
I would say 80% of our patients are financing it.
Is this across the country or just your office?
I think this is across the country. There's a huge push among a lot of the banks to create a product to fulfill this niche.
Okay. So you have to have okay credit. Do they accept cosigners? Since we're talking about this?
Yeah, they do accept cosigners. Yeah. Yeah, you have to have okay credit, and they'll accept cosigners. Absolutely.
And get that out. What else affects the cost?
The next thing that affects their cost is how much surgery do they actually need. So sometimes we have to go a little higher in the face to get anchorage for the teeth.
Okay.
And so there may be more costs associated with that. Sometimes there's many teeth that need to be extracted, so that may affect the cost. Sometimes, rarely, but sometimes there could be even some grafting involved. So we may
like bone grafting, things like that.
Correct. So that could also affect the cost.
Okay. Now, what about experience? Now, you're an oral surgeon. You're a medical doctor. Is this true, like oral, like especially with your training? I mean, like accident victims. I mean, you could literally put the whole face back together.
That's right.
And that's in
That's
your
right.
training.
That's all within
So
our
this is
training.
kind of easy for you. I don't want to put words in your mouth.
Right. I mean, this is in our wheelhouse. All of this is in our wheelhouse. This is what we do. This is what we're trained to do, essentially.
How important is that experience? Because experience affects the cost
Absolutely.
of getting it done once.
Getting it done once. You want to get it done once, and you want to get it done right.
I had a guy in here that said, Randy, we were talking about dental implants, and you know who it is. And he said, sometimes it's like inexperienced guys, they may have to go back and forth 30, 35, 40 times to the office to get it right.
That's right. That's right. So,
That's what inexperience does. Is that true? Is there truth to that? Do you see that?
Yeah. I mean, the goal is to get this done in as few appointments as possible. And the less experience you have, the more appointments it takes to get from point A to point B.
Is this true that when dental implants, when general dentists or other dentists have problems with their implant, they always end up in the lap of the oral surgeon?
They're typically sent over to us.
Is that right? So you do a lot of fixing, a lot of repairs?
That's right. That's right. Yeah. So when things just don't go right, usually there's some surgical aspect to it. So then they'll send it to us for repairs.
Now, I know you want to stay positive because I've tried to put you on the spot about a few things, but do you have any type of a bias? Like you should go to somebody that's done a lot of these, or at least, they're a board certified oral and maxillofacial surgeon.
Yeah, so I think the biggest factor is you should go to somebody who's got a lot of experience in this. That's where my bias would be. So typically oral surgeons have a lot of experience on the surgical aspect of it. But the most important thing is that you go to somebody who's experienced, who knows how to handle complications.
Okay.
So you're not running around town trying to find someone else, and somebody who's seen it all.
Have you done hundreds of these?
We've done hundreds of these.
Is that right?
That's right. Yeah, we've seen it all.
I mean, you do a lot of these day in, like every week you do one of these?
Yes, absolutely.
Is this like golfing, by the way? Like, you'd be a great golfer, but if you don't golf all the time, you're not so good?
That's right. That's right.
Do you get into a rhythm of doing these type of procedures?
That's right. It's part of the appeal.
Okay.
Just like golfing is an appeal to some people, of trying to get just getting better and better and better and better every time you do it. So with the frequency that we're doing it with and the technology that we have backing us, I mean, it's really a game changer.
Now, look, I'm trying not to side with you. I know what the national average is to get a full arch of teeth supported by implants, and everybody's charging about the same.
Sure.
Within 1,000.
Sure.
Right? And so to me, and correct me if I'm wrong, I mean, if you're going to do this, you might as well go to somebody that's super qualified to do it.
That's right.
To get it done right the first time.
That's right.
Because you want to minimize your risk.
That's right. Yeah.
You must have strong opinions about this. Because there's guys dabbling in this.
Yeah.
And I know you want to be positive.
Right. So there's a lot of clinicians that they don't have a flow of patients that's needed to get good at doing this ultimately. So they're not able to become efficient. They're not able to get as good as they really need to be in order to do these on a regular basis.
Okay. Now, I was talking to a surgeon, and he said, one of the problems that frustrates me is if you don't understand the bone, you put the wrong implant in softer bone, and then you have problems.
Correct.
Do you run into that? Is that something that, as an oral surgeon, I mean, this, like you said, you said this is in your wheelhouse.
Correct. So, I mean, yeah, we don't know how soft the bone is until we actually get in there.
You can't see it on a CT, really?
You can't see it on a CT.
Is that right?
That's right.
Is it by feel?
It's by feel. That's right.
Is that right?
So it's not until you actually get in there that you know how soft the bone or how dense the bone is.
So 1,000 implant procedures later, you have a feel for it.
Correct. And then you kind of have an understanding of how to stabilize that implant.
Okay, good. Well, look, I want to thank you for coming on the program and lots of questions answered. And of course, if they want to make an appointment, they get to see you at the office.
That's right.
And they just call your office, make an appointment.
That's right.
So that's why when they call, and because we talked about this, like 8 out of 10 callers. How much are dental implants? It's not that easy.
It's not that easy.
It would be misleading to give them a price over the phone. That's like a diagnosis over the phone.
That's right. And we the last thing we want to do is mislead patients. So we want to give them the most, just like surgery, it's got to be precise. We want to give them the most precise, accurate answer that we can. But there are all of these factors that play a role in determining the cost.
All right, I want to thank you for coming on the show. Good stuff.
Thank you for having me, Randy.